Bloating is a quite common symptom that brings patients to a gastroenterologist. What is bloating? Bloating is the feeling of a distended abdomen. And an abdomen that is distended not all the time, which could be obesity or something more severe called fluid in the abdomen called ascites, but an abdomen which is distended mainly because of air, because of gas. This is bloating. Bloating can be caused by several causes. The most common cause that brings patients to our clinics with bloating is the famous irritable bowel syndrome. Apart from that, certain food intolerances, like for example, lactose intolerance, intolerance to dairy products in particular, and wheat intolerance, we call it celiac disease or gluten allergy. These are examples of food that can cause this bloating. Bloating is a very atypical symptom, and sometimes it's difficult for the patient to anatomically locate the level of bloating. But a bloating that is mainly felt in the upper abdomen and in the area of the stomach and usually occurs after food, this may indicate a poor motility of the stomach. And if the patient is diabetic, we call it diabetic gastroparesis, because diabetes can affect the nerves, which gives motility to the stomach. If the bloating is in the lower abdomen and the patient is constipated and the bloating improves after defecation, this is bloating related to constipation, and the treatment is just laxatives. If the bloating is all over the place and covers the whole abdomen, we are thinking of this very long and very important organ of the digestive system called small bowel. And this is when we think of food intolerances, because the small bowel is where the food is absorbed from, or a situation called small intestinal or small bowel bacterial overgrowth. Quite a few patients with bloating also produce gas, and they call it flatulence. And this is really embarrassing for them. So this symptom quite often indicates, apart from IBS, something that I just mentioned before, called small intestinal bacterial overgrowth. And this can be seen in patients who have undergone previous surgeries, patients with diabetes, patients with impaired immune system. And this can be easily diagnosed, this small intestinal bacterial overgrowth. You can find as SIBO with just a breath test. And this can really solve the problem and improve the patient's quality of life. So bloating, apart from irritable bowel syndrome, food intolerances, and small intestinal bacterial overgrowth, if it is associated with other symptoms, such as pain, nausea, vomiting, may indicate problems in the small bowel, and in particular obstruction at certain levels of the bowel. So if the patient definitely experiences severe pain, especially if the pain wakes the patient up during the night, nausea and vomiting together with bloating, this definitely represents an indication for investigations with imaging of the abdomen, and in particular a CT or an MRI of the bowel. If the bloating has been investigated and no specific cause have been found, and the doctor concludes that the bloating is just a feature of irritable bowel syndrome, then patients can use those famous powders, tablets, or drinks called probiotics. These are the good bacteria which can be swallowed and accommodate the patient gut within 30 days. So a message is when we take probiotics, we should give them a chance for at least 30 days and be aware that those good bacteria can cause more bloating in the first 7 days. So don't stop them because they fight against existing bacteria. So probiotics for at least a month is one remedy. Or, for example, you can buy over-the-counter charcoal tablets, for instance, and modify your diet. Some patients need to modify their diet and, in particular, avoid foods that produce gas or beverages like Coca-Cola, Sprite, and onions, lots of greens, good stuff. So those are producing gas. And these are simple things that the patient can do.